This morning, we are learning more about a local program designed to reduce the number of mentally ill people who end up in jail, and here in Duval County, on misdemeanor charges. It's called the Mental Health Offender Program, or MHOP. Chief Judge Mark Mahan of the 4th Judicial Circuit, which includes the Duval County Courthouse, by the way, joins us via Zoom to explain how it works. Good morning. Thanks for being with us.
Good morning, Jennifer. Thank you for having me.
So, Judge, this program specifically focuses on those who have mental health issues, as I mentioned, who get arrested frequently, again and again, for misdemeanor offenses. Why did you feel it's so important for those who created this program to focus specifically on these kinds of inmates?
Well, Jennifer, there's always a discussion about who is appropriate to have in jail and in custody. And there's a strong belief that regardless of your feelings otherwise, that there's no reason at all to have the mentally ill in jail at all. And jails have become the largest mental health treatment facility in the community. With that end, the sheriff's office and the city got together and asked to look at those individuals that get chronically arrested in the community and are chronically taxing the resources, and see if there's a way we can try to solve this problem.
So it's interesting because I don't know that the general public understands the financial burden also that these arrests place on the judicial system. Would you explain how much money we're talking about that this could save, should it work?
Well, Jennifer, the sheriff's office identified about 220 individuals that are in the community that are, again, they're chronically arrested over and over again for really small, petty crimes. They're bothering merchants, they're bothering people in the community, they're creating a disturbance. And it's not necessarily because they're criminals, but because they have ongoing, untreated mental health issues. And to this end, the sheriff and the city, Councilman Salem, looked at this problem and said, there needs to be a better way to try to solve this. This MHOP program, as we've described it, identifies those individuals. So when these people that frequently get arrested are arrested on new charges, they're flagged, they're immediately pulled out and try to divert their case into a program where they get treatment, where they get services. We try to get them stabilized, some type of housing, and try to get them out of this cycle where they continually get arrested, get released, get arrested, and rearrested.
And Judge, I also just want to make it clear, it's not that for some reason for those people who are watching, who might be a merchant who is constantly bothered by someone that fits into this category, it's not that they're kind of getting off, correct? I mean, they are required then to, should they accept this help, to follow through.
Well, and of course, it's like drugs or a lot of other recurring problems in a community. The first thing you've got to do is break the cycle. And with people with mental health issues, that means getting them medicated, getting them treatment, getting them counseling, and getting them a stable place to live. We had identified, again, about 220 people in the community that might be appropriate for this program. Within the first week of the program, an individual that was flagged for participation was arrested. He was arrested 25 times last year. The actual cost of that with the sheriff's office from arrest to booking was about $21,000 last year, according to estimates released by the sheriff's office. So this individual now has been arrested. He's been put in the program. They're trying to provide services and trying to break this cycle through that type of treatment and programs. If we can continue this, we plan to target about 20 to 40 individuals. We try to keep the cost of recurring arrests down, the calls from the sheriff's office, try to get this person treated, getting them an individual who is contributing to society, working, functioning, and they don't tax social services and all the other allied programs that cost to the community. It's estimated someone with an individual with mental health problems costs the community about $50,000 a year. And this can substantially reduce the costs associated with that.
Well, Judge, I am looking forward to having you back on to talk more about the program as more people enter it, to see what kind of success it has. It sounds like something that all of us taxpayers should certainly appreciate. Thank you for your time this morning. Really appreciate it.
Well, thank you so much, Jennifer. And it's always a pleasure. It's a very interesting topic, and I'd love to talk to you about it.
So I also want to point out to our viewers that these are nonviolent misdemeanors, that those who are eligible for this program who've been arrested 4 or more times since 2007, they cannot have any open felonies classified as sex offenders or predators. I think that's an important point to make.
Yes, ma'am.